Hi, this is Dr. Suzanne Stonbely, your mind-body doctor. Let me give you a brief introduction about mind-body medicine. From the earliest times we know, people have always been in awe of being able to control their body or experiencing certain sensations or even healing. Every ancient civilization since the beginning of the time has found a way to reset the central nervous system, to take stress away. Some people call it a form of practice. Some people call it repetitive prayer. There were the whirling dervish who spun and spun until they went into a trance. Now we know what's involved in this. The alpha brain, or the alpha brain waves, are waves that are long, sweeping curves that allow us to recognize when our mind is in that open place, like right side brain activity, creative, relaxed, open to suggestions. The nervous system is running on a calm energy. We're down from fight or flight. We're in that relaxed state. As opposed to beta, when the waves are short and characteristically have a spike, a high arc, and are very close together. And brain activity in that is on vigilance, watching out. So if you could think of your smoke alarm in your house or your sprinkler, if you strike a match, you don't want the fireman to show up at your door. But if your house is burning down, you certainly want them to come. And what happens is our brain gets calibrated to a very high speed nowadays. And instead of having the function of being able to, say, run from a dinosaur like we were created to do 5,000 years ago, and be able to slow down certain body functions so we could run faster and have our heart beat faster, our blood pressure go up so that we would be at high alert, our thinking processes have become so complex and bombarded with technology. It's like having a CN ticker continuously in front of our face. So it's very imperative at this time in history for us to come up with practices to allow our brain to go to a resting state. Because the area of psychoneuroimmunology, or PNI, is the actual study of the mind-body connection, where we look at how the psyche affects the neurological and the immune system. And what we find is that when we are on this high level of energy, cortisol is secreted heavily. A lot of people are having belly fat for this reason. High levels of belly fat, coupled with low numbers of sleeping, contribute to this. Another thing we find in today's society is all these advertisements for all kinds of medicines. Restless leg syndrome, and again, where the muscle tissues have taken on tension. So instead of medicating your whole system with the drug that was originally started with Parkinsonism, being able to have a form of practice to relax yourself so that you could sleep and let those muscles relax. Back pain and back disorders are another one where the muscles that run deep along the vertebra start to pick up your tension and actually pull these discs out of place. Back science knows that surgery is not a real science, and that most people, if they have surgery, don't feel an improvement. In fact, they did a study in the European countries, and they found out that they made 3 groups: people who did nothing when they had back pain, people who had chiropractic, and people who had surgery. And there were basically no differences between the groups. So as we know, our mind dictates how our body systems function. Originally, it was a wonderful subconscious way of doing it. Now, however, it's reverted to a system that throws off the heartbeat, elevates the blood pressure, tenses the muscles. Concentration is another area that is deeply impacted with stress. And what happens there, instead of being able to focus your mind and have executive functioning, being able to calculate, being able to remember things, being able to focus and be calm, we find that the brain goes into open focused and is taking in a wide area as opposed to focusing. And actually, attention deficit disorder, I truly believe, is that the system is calibrated at such a high rate, and there's this idea that the brain is in danger, that all activity is increased, concentration decreases. We see with a lot of our children, they're having asthma, they're having multiple colds, they're having digestive issues, and what we find is the immune system is being impacted. Having children go from 6 o'clock in the morning till 6 o'clock at night is something that just started since the 1960s and 70s, where children used to be latchkey children or go home and have downtime, and now they're so overscheduled. Our biology hasn't caught up with this. So this is a brief introduction. I've been in the field for over 25 years, researching in clinical practice and developing these practices. I've worked with people from the age of 105 in Miami, Florida. When I first started out with a lot of geriatrics, I worked with celebrities and models, and I've worked with young children, and I've also taught parents how to do conscious parenting, hypnobirthing, and being able to really understand how the brain works so they could have successful lives in many different dimensions. And so when you balance this, you'll find that your career, your relationships, your weight, your ability to concentrate, and most of all, the ability to manifest a life that you love. As Napoleon Hill once said, anything you believe, you will achieve. So allow yourself to be open to receive these messages. My